Hi, my name is Charlie Davis. I'm one of your classmates in the assessment class or course at Liberty University. I'm a student for clinical mental health. And today I decided to review the Milan Adolescent Clinical Inventory. This test, unlike other self-report tests, it's designed to be performed either on the computer or in a clinical type setting. It's not one that you just do online on your own. In fact, there's a process and things that you need to be aware of to make sure that you maintain the validity and the reliability of the test, which I do want to point out that on the Pearson website, it was impossible to find the validity or reliability numbers for the MASI, the Milan Adolescent Clinical Inventory. So I had to go out and do my own research, and what I found was that the article stated that there was an internal consistency between 0.71 and 0.93. However, it didn't really address whether or not the report was valid in it, per se, as far as what it's used for. But it is a personality inventory, and there's multiple subscales within it addressing introversion, depression, things like that, to kind of uncover maybe what's going on beneath the surface with the child. So when you look at the norm population for this assessment, it is teens. So it's anywhere from 13 to 15-year-old males, 16 to 19-year-old males, or 13 to 15-year-old males, or 16 to 19-year-old females. This assessment is aligned with the DSM-4, not the DSM-5, but the DSM-4. And it is designed to work with inpatient or outpatients. This test could be completed in about 30 minutes or less. And the cost can be anywhere between $25 and $40 if you do it on an individual basis. There are kits that cost anywhere of upwards of $130. The purpose of this test is to uncover difficulties that may prevent young clients from making the most of important years. So it assesses their personality patterns, along with self-reported concerns and clinical symptoms. And the results, the designer claims, can be used to put together treatment plans. Some of the things that I would have liked to have seen on the website or in the brochure, since you couldn't get your hands on the manuals, were specifically what are the reliability and validity of this actual assessment. How do the subscales, based off the way they put the test together, how does that work in the sense of how does it address issues that are prevalent with teens? I just didn't see enough studies on it. I see what it's meant to address and uncover, but even the scales themselves, there wasn't a lot of definition. So I would like to know a little bit more about the subscales in relation to this test.